Live, this is South Florida Today on NBC6 HD.
Well, when you hear the word cancer, it can be really overwhelming no matter what type. But unlike other forms, skin cancer can affect your physical appearance. To talk about the latest advancements in reconstructive surgery, we have Dr. Ryan Greene here today. And we're talking specifically, you could probably say this better than me, about Mohs reconstruction. How would I term this?
Well, it is termed a reconstruction after Mohs surgery, but oftentimes people call it a Mohs reconstruction. You know, I think most people in South Florida are aware of the damage that the sun can cause to the skin. You see it all the time in people's faces. But more importantly is really the increased risk of development of a skin cancer. You know, statistics show that around 1 in 5 Americans during their lifetime will develop a skin cancer.
Oh my gosh.
And yeah, every year approximately 1 million Americans are diagnosed with a skin cancer. Now, the great news is that for the majority of the skin cancers, they can be easily treated with a great treatment, and that is the Mohs surgery.
Okay.
Mohs surgery.
Yeah, how does this work? Because it's a little different than
It is.
others.
Mohs surgery is performed by a specialty-trained dermatologist who's trained in Mohs surgery. In this procedure, the dermatologist takes sections of tissue that they look at under the microscope while the patient is still in the office to make certain that the cancer is gone. And the beauty of that is the patient, when this surgery is done, leaves with the confidence that the cancer is completely gone.
Okay, well, what I didn't realize is that the skin cancer can have roots.
It can.
And you said sometimes a small little blemish can actually be much bigger underneath.
That's right. Sometimes even a small lesion down, extends deep into the tissue and can have these large roots, so that a small lesion can turn into a much larger defect. And that's where I come into play. For these after the Mohs surgery, if it's a small defect, typically the dermatologist or the Mohs surgeon oftentimes will repair that in the office. But for the more complex defects, oftentimes they'll call on me to help repair that. And that's where I do the reconstruction.
Yeah, and let's talk about some of this stuff, because you were saying it's not just physical. I know some of these people are very conscious about, scars and being afraid to go out in public, perhaps, which they shouldn't be, but they may be. But it also comes into play. You said this woman, if done incorrectly, might have had a problem with her eyelid.
That's right. There's, on the face, we have to worry about appearance and about function. And in a lesion like this at the top, she's got a moderately sized defect on her upper cheek. And if it's not closed properly, that can pull down on the lower eyelid, changing the symmetry, the appearance there, but also the function of the eye as well, with tearing, etc. And we have to worry about this function with other areas like the nose and the lip. So in a patient like this, you can't just stitch it closed. It's large enough where you have to do something called a local flap. And that's where you take adjacent tissue next to the defect and slide it over. But in order to do that, you have to make long incisions along the cheek so the tissue can move and cover the defect.
I mean, it's amazing, though. It looks...
Well, she had a great result, and I think that's why I take such great care in closing these very meticulously to optimize the scar appearance. And in the second, you can see the same thing in the lower photos there. Now the ear's a different ball game, because the ear's got, as you know, a very
I said that
contour.
Looks small. Why couldn't it just be left to heal?
That's right. And the thing about the ear is that the skin is very tight on the cartilage of the ear, so it doesn't move very easily. So closing this really is not an option. And there are a couple of different options. I again selected a local flap for this patient, where I took adjacent skin and slid it in by making long incisions. And the incision here went down the ear, and
I didn't even see it until you pointed it out to me.
And you can tell here that in this patient, he healed very well. He's very pleased, and he has great symmetry with both ears, and that's another thing you have to keep in mind.
Okay, and this has got to be the most rewarding of your work, huh?
It's among the most rewarding, for sure. It's very fulfilling to be able to have such a great impact on the patient's life this way.
Okay, you do a great thing. Thanks so much for coming and talking about it today.
Thank you very much.
Okay, if you want more information on Mohs micrographic surgery and the reconstruction process afterwards, you can call Dr. Greene at 954-651-6600 or go to drryangreen.com. Nathalie, over to you.